Okay, welcome to our show. Our first guest is Dr. Gero. Dr. Gero is a holistic naturopathic doctor, and his center is right here in Clifton, actually. And we're going to learn a lot tonight, and I'd like to welcome Dr. Gero. Thank you for coming to the show. I appreciate it.
Oh, my pleasure. Thank you for inviting me.
Since this is probably a new topic for a lot of people, let's just start out with what is naturopathic, am I saying it right or wrong, but pathic medicine?
Yeah, it's naturopathic like nature.
Okay.
And naturopathic medicine basically is all about living in concert with our natural laws. Eating properly, exercising, thinking properly, taking the right supplements as we need. And this is all important because if we don't do the things that are appropriate for our lifestyle, we're not going to be well. And oftentimes we're looked at as alternative medicine. But nothing could be further from the truth. Basically, what we do is conventional, is basically the lifestyle medicine is the way we're supposed to live, and it's first line medicine. So if you're not eating properly, if you're not exercising properly, you are probably a candidate for doing some of the medications that are going to be prescribed by your medical doctors.
So, Doc, can you just explain conventional medicine and holistic medicine? I know it's medication, but maybe you could elaborate on that a little bit for us.
Right. Well, with conventional medicine, if somebody has not been living appropriately, they may be diagnosed with diabetes. Now, a conventional medical doctor is going to treat that diabetes with diabetes medications. With me, if somebody comes in and they've got elevated blood sugar levels, which we would like to get somebody before they actually are diagnosed with diabetes, and be able to change their diet, change the way they live their lives, and if we can do that, we can reverse the effects before they actually become diagnosed with diabetes. But we do get people that do have diabetes, and we're able to reverse that with the appropriate lifestyle implementations.
So, Doc, how many people come to you as a last resort? Because that's what it seems like. They try everything, and then there's the last resort.
Yeah, we don't necessarily love last resort.
No, I know.
But a lot of people do come to me last resort. And for example, cancer is a big part of my practice. I would say cancer is in the top 5 reasons that people come to see me. We've done really well working along with the oncologists, and there's a number of things that I can do that can augment what they're doing with the oncological team. So if we change their diet, change their perspective, and with cancer, for example, a lot of people come to me and they've got 4th stage cancer. And can I give an example of somebody? Somebody came to me with pancreatic cancer, which is a pretty serious cancer. She was given 3 months to live. So I called up her oncologist and I said, these are some of the things that I want to be able to do in addition to what you're doing from a conventional standpoint. So several months later, and probably 6 or 7 months later, her oncologist told her that her tumor markers were down 70%. And when she thanked the oncologist told her, don't thank me, thank the naturopathic doctor you're working with. She lived another 3.5 years with a very, very good lifestyle.
And I can appreciate that. Obviously, it doesn't work for everyone. Depends on the stage, and
that's true.
And we're not advocating for this, but an example is a good example to mention to people that sometimes you want to try everything. People get sick, they want to try it. And I think, and correct me if I'm wrong, if people are going for chemo and different treatments, their nutrition is lacking.
Yeah, that's true. And you know, it's almost laughable when people are doing chemotherapy. Oftentimes, during the chemotherapy and as they're walking out of the chemo room, they're given donuts or pastries. And basically, when you think about it, sugar proliferates the growth of tumor cells. So it's almost antithetical to give somebody something that's going to enhance or encourage the growth of the tumor. Whereas what I do by changing somebody's diet, giving them nutrients that are going to support the immune response, enable the chemotherapy to work better, improve their mood, and they've got a better chance of surviving. Now, I can't tell anybody that I'm curing their cancer. What I want to be able to do is enhance the integrity of the body, the physiological response, so that the body can thwart what is it's being affected by.
I understand that too. So, other than cancer patients, what other type of people would come to you? Would they come with you for sports problems? I'm not too sure. We could elaborate on that.
Yeah, you know, sports is a particular interest of me. I would consider myself very strong-minded in sports nutrition, but it's not a big part of my practice. The things that people come to me is anything from chronic fatigue to late-stage cancers. I do a lot of endocrine issues. I consider myself a thyroid specialist. I deal with a lot of blood sugar issues, cardiovascular. I've had people with congestive heart failure that we were able to get out of congestive heart failure. It's considered an area that there's no cure for. But I've had cardiologists that said, hey, I want to go out to dinner with that naturopathic doctor because I want to know what he's doing, because we've had really good success. I get people with joint issues or, you know, arthritis, a lot of autoimmune conditions such as rheumatoid arthritis, multiple sclerosis, lupus, Hashimoto's thyroiditis, so a very big part of my practice. The second leading reason why people come to me, believe it or not, is anxiety and depression. And if it's not the leading reason that they're coming to see me, it's ancillary to some of the other issues that they're confronted with.
You know, I'm glad you mentioned that because it seems that anxiety and depression is very big. Mental illness nowadays is on the rise. What's the correlation between anxiety and nutrition? You know, you hear that too much caffeine can trigger this. I'm not too sure, but if you could just, that would be helpful for people to realize.
Yeah, and I find that there's more anxiety and depression now than ever before. I don't know if it's COVID related or it's our lifestyle or it's the internet, but all of these things probably are consequences of this decline in mental health. But in terms of nutrition, a lot of times people are depressed or anxious because they're not eating properly. There's fluctuations in blood sugar levels. So we have to look at that. We also have to look at foods that they may be sensitive to. You've got more people sensitive to some of our foods today, people that are eating a lot of refined carbohydrates, and their blood sugar levels are all over the place. But many of the foods that people are eating are just inappropriate for them, and it triggers a negative response to some of the physiological functions in their body. So that's an issue. But I've also devoted a considerable amount of my continuing education to mind-body medicine. I've been studying mind-body medicine since 1971, and I've completed master's level training in mind-body medicine from Harvard Medical School. So I do a lot of coaching and counseling using biofeedback, acceptance and commitment therapy, cognitive behavioral therapy, guided imagery, so to augment some of the recommendations I'm making with their dietary regimen. And exercise. Exercise probably is one of the leading reasons to reverse anxiety and depression. So we're looking at a 360-degree aspect in reducing their anxiousness and their depressive issues.
So, Doc, now what I want to say is, what's a typical first session? Because if you want to determine their nutrition, so how does this work with the very first session?
Well, unlike going to a medical doctor, I'm not picking on the medical doctors. They do great things for severe issues, acute issues. You want to be in an American hospital with an American doctor. However, because of this current state of medicine in this country, doctors can only spend 10, 15 minutes, if you're lucky, with a medical doctor. My first appointment is an hour and a half. So it's anywhere from 60 to 90 minutes. But my questionnaire, my initial intake questionnaire is 16 pages. So we're getting a lot of information about that particular patient. So even before they walk into my office, I've gone through 16 pages of data trying to be able to narrow down what's going on with that patient, what are their symptoms, what are the areas that they're having the greatest problems with. The other thing is I'm an expert in interpreting blood chemistry. And I've had a number of friends that are medical doctors, and blood chemistry is not one of the things that's really looked at closely with medical doctors. And I know it's ironic because they use that as a tool. But to me, I'm looking at the relationship of the values to each other. So between what I do with looking at blood chemistry, we actually clip people's hair and we send it to a laboratory because it gives us an idea of what's going on from the tissue levels. So we look at many, many different aspects. I have a scale in the office where we're looking at body composition in terms of not only their weight, their body fat percentage, their muscle weight, their bone weight, and also looking at the distribution of water in and out of their cells. So looking at a number of different factors, we can come out and find out what are the causes of their issues rather than just treating a symptom.
So also, when the people come in, would you, I don't want to say counseling, but do you offer them advice? You know, you're saying exercise, diet. Would you sit down and say, gee, do you exercise? Or maybe you should 4 days a week? I know you don't give them a program, but is that part of it, like counseling per se? Yeah,
well, we really do give them a program. However, it's a partnership. Okay. And the interesting thing is when somebody comes to see me, I never tell them what they should do. And I know that sounds counterintuitive, but it's really a negotiation between what a patient feels that they should do, what they're capable of doing, what their threshold is, and me advising them that these are some of the things that you may consider. So I will give them a number of areas that they may consider, and it's up to them to be able to decide, am I ready for this? What am I willing to do? What am I capable of doing? And most importantly, what can I sustain over the long period of time? Because if you create a program, if you start a program, nothing happens unless you stay with the program, because you get a lot of people that say, you know, I exercised for a couple of weeks, I felt really good, but now I'm not exercising and I'm back to where I started from. And I said, geez, you really need to make a determination as to what you need to do long term. So it's really a matter of sustaining that. I have a byline in my practice that wellness is not a part-time job. And it's not as easy as taking a pill and all of a sudden I feel better. It's really about adjusting your mindset to what do I need to do to maintain health for as long as I'm going to live.
Thank you. And I just one last question. Actually, I seen a thing saying that life is not a spectator sport. That kind of says it all. The last thing I want to ask you is, because there's a lot of people out there in all different kinds of conditions, young or older, is there any time that it's too late to start a program in life?
You know, I see everything from newborns. Actually, children are a big part of my practice. About 10-12% of my practice are kids, and even young kids. So I see anything from newborns up into my oldest patient was 102. One funny story, because my patient that was 102, I was working with him for, at that time, probably for about 12 years. And he said, you know, I'm starting to get a lot of issues. What do you think it is? I said, you know, is this the first time you've been 102? He laughed too, but he didn't necessarily think it was funny. But I do deal with a lot of centenarians. Not centenarians. I'm talking about people that are over 70. You know, the fortunate thing is I'm older than most of my patients, so I can certainly understand what their issues are. But part of my background was I used to work for a company called AgeWave. And AgeWave was an interesting company because it really analyzed the transitions in life and how you would reposition your life in accordance to where you are from an aging standpoint. And transitioning your life is really important. And a lot of older people that are retired, they have, in many ways, they feel like they've been put out to pasture, and they're sitting on the couch waiting to die. And we want to be able to instill a sense of purpose. So at any stage, we want to be able to do that. So keep in mind, it's not just a matter of let me organize your diet and tell you what foods to eat, but really having you understand all of the ramifications of successful living, and thinking is a major aspect of that.
Doc, thanks. It's a lot of information. I appreciate you coming on, and I'd just like to leave everybody with health is wealth.
All right. Thank you very much for having me. This is a pleasure. Thank you.
Very much. Stay tuned. We'll be right back.